Great. This is Abby Goodman. I'm the Executive Director of ACEC Massachusetts, and I'd like to welcome you to the June 8 meeting of the ACEC Mass Health and Safety Forum. With me here this afternoon is Steve Hawkins, one of our co-chairs from GEI Consultants, and we'll be joined by Dave Langley, our other co-chair, shortly. Steve?
Thanks, Abby. Welcome, everybody. I know this isn't our quote-unquote normal health and safety forum scheduled meeting, but I guess these days, what is normal? But it's something that I think has been very helpful. I know has been very helpful to me, and I think to the rest of our membership, and then beyond the health and safety forum, to have these calls more regularly, just to keep us all abreast of what's going on, around this ever-changing COVID-19 situation. And it helps just to talk through some best practices and hear about what other of our peers are doing to address some of these things, and look forward to opening offices or going out into project sites or things of that nature as things open up a little more. I do ask that if you are not going to be speaking, keep your microphone on mute so we can stay away from any background noise or feedback or things like that. And today's, like I said, there isn't a set agenda. Today's forum call is very similar to the last one we had, which is free flowing. It's open to everybody to contribute, talk about best practices. What are you doing? What are you seeing? Or questions you may have. You can either take yourself off of mute and ask those questions, or place your questions in the chat room, and we'll be monitoring that and try to address those the best we can. Before we dive in, Abby, I just want to kick it back to you to see if you have any updates or anything else you want to bring up to the group.
Thank you, Steve. Well, first of all, I want to recognize that we've been joined by David Langley, who's our other terrific co-chair of the Health and Safety Forum. And I really want to thank both David and Steve for what you've been doing by having these sessions about every 2 to 3 weeks. I think it's been a great way for the community, for our ACC engineering community, to be in touch with each other about best practices and what the challenges are that people are facing. Many of you will know that over the weekend we moved to stage 2 in recovery, or reopening of stage 2, which means that more of your offices may have been seeing some people today, as well as other businesses are engaging in some limited reopening strategies. But as always, stay tuned to our COVID-19 resource page on our website for those updates, and look for ACEC Matters every Thursday. Thank you, Steve. Thank you, Dave.
Great. I just want to start off with things, as Abby mentioned, Massachusetts has gone into stage 2, meaning more things are going to be open. Of course, there's restrictions that go along with all of that. And a lot of other states are doing similar things. All the timelines are different, but a lot of the plans, a lot of the reopening, and a lot of those restrictions are similar across the board. One of the challenges that I'm having, being with GEI being, across the country in multiple states, is trying to stay on top of all that stuff to give direction to all of our various office locations on what they need to do, what they need to consider. And the clear message that I'm getting across the board here at GEI is that we understand things are different. We put in place a process where each individual branch office location has to develop their own plan, so they make sure they meet their own local guidelines, and they make sure they have our GEI minimums in place before we allow anybody else back into the offices. And the message I'm getting from a lot of people is that there really isn't a big rush. And fortunately, a lot of the offices, and talking specifically about offices, our project sites are kind of a whole different conversation. There's not a lot of rush the way we're set up right now to just push people back into the office and get people back into the office. We figured out this work from home thing. We were forced to, but we figured it out pretty quickly. So people aren't going to be rushing back. And I think that would be my advice to everybody here, is if we don't have to go into a situation where there's a lot of unknowns and we may not be prepared, let's take our time and plan appropriately. And I think that's what we're seeing at GEI. But of course, that's something we all have to consider on our own with our own situations. and plan for that as well. Now, some of us don't have that luxury. And like I said, our project sites, we have a lot of project sites that were deemed essential. And then as things open up, even the non-essential project sites, non-essential construction is starting to reschedule things. And I anticipate seeing a push because people are going to want to open them up, but then still try to catch up on schedules. So that may become a factor as we schedule things and as our workload increases after this quote unquote lull we've experienced. So that might be another challenge for us. So there's still a lot going on. A lot of states are opening up and moving through the stages. And one of the things I'm trying to monitor as well on top of all this stuff is are the COVID cases and how are they reacting to the opening? And then to add one more layer of all of this, we have a lot of the civil unrest and the protests and the riots and things happening across the country. Thankfully, a lot of those protests are peaceful ones, but it does mean there are large groups of people getting together amidst this time where we're not supposed to be getting together. So people are monitoring that too to see what does that mean in terms of the COVID and how things are spreading and whether different states are going to end up having to move towards a shutdown instead of a reopening based on not separating ourselves and having these large protests and things. So there's so much going on. And I guess with that said, open it up to others to voice your questions, share your experiences or best practices. Before you do, Dave, I want to just kind of kick it over to you. I know we didn't have a chance to chat before this call, but do you have anything to add?
No, I'd also like to thank everyone for participating today and participating in several of the meetings. I see a lot of similar faces, a few new faces. So thank you again for joining our forum. Just to echo what you've said, Steve, it's been the same situation with our company. Obviously, to fill out that handy-dandy Massachusetts, come back to work form with cleaning schedule and the who's in your office on which days and so on and so forth. So we've got that going. We've got all the signs posted we need to have posted all over our office. Soft opening pretty much for us too. We extended the invitation to everybody to come back, but told them do what you're most comfortable with. And I believe that's the intent of the way that the governor has been rolling things out here in Massachusetts anyway, is to discourage people from coming back to the office. Whether or not that's good financially for the smaller businesses or our landlords in the future, now that we're seeing that we can do a lot of this remotely, that has yet to play out, but it'll be very interesting. I think the landscape's going to change, maybe not dramatically, but it's just going to be interesting how things change moving forward. That's definitely been a big question within our company at this point, is what will things look like when we reach the new normal? How many people are we going to allow to work from home? How are we going to navigate those waters? We did present a survey, which I shared with the group. If you haven't got a copy of it or haven't seen it, let Abby know. I believe she has a copy of one or two of the surveys that we put around our company. I didn't share the results, but I shared the questions. But the results in themselves, there are several employees who do want to stay working from home in the long term. And I think it extends beyond even vaccine or what have you. They just enjoy working from home. They feel they're more productive. It works better for their schedule with whomever they need to take care of, be it other family members, children, what have you. So that's an interesting part we're trying to navigate. And I know that at one point in this forum, before we got to the COVID situation, we'd been talking about what do we do about what constitutes employee safety if your employees are working from home. So that looks like it's going to be a forefront topic coming up in the near future, is how do we handle home safety of our employees if they are working from home predominantly? What does that look like from the HR standpoint and the liability standpoint? So that's one of the future topics we're going to have. It has been on our list, and it's going to be more prevalent now. But just wanted to throw that out there to you. And if anybody has any other topics you'd like to see us present, please reach out to us. My email, Steve's email, and Abby's email are all included. Email us, let us know what you'd like to see. We had done a survey at the beginning of this year before this happened, listing topics that we wanted to present and speak about. That certainly won't go away. And as things start to calm down now, we hope we can go back to that. But with COVID being the hot topic, we've made that our standing topic as things are constantly evolving. So we do want to open that back up to everybody. So please let us know what your thoughts are, what other topics you'd like to hear about. And with that, I'd like to open it up to, like as Steve said, for other comments on what your current situation is, or what you may have questions on how our peer firms have handled the reopening.
Hi, this is Connie Taggart from Wright Pierce. I'll actually put my video on too so you can see me. I'm actually curious about Massachusetts and this phase 2. I'm just trying to look through the website to see, has he increased the percentage of employees that can go back to the office at this point, or is it still at 25%? Does anyone know?
Still at 25%.
It is. Okay. Thank you, Abby. I appreciate it.
I know there's no measuring stick for that yet as far as what will determine when that goes up. That's correct, Abby? That's what you know as well?
That's what I've heard at this point. There's no particular date.
Okay. All right. Thank you. And I'll just echo really what Steve and David have said. I think it's a real slow return to the office. We are trying to encourage our employees in particular to try to get back to the office so they can do a direct connect to the network. We've found that with everybody working remotely, if and with our current IT setup, that if we connect in just through VPN and then stay away from the office and not connect into the network, we've found that there are some individuals, and it's unique, you don't know who it's going to be, but when they go back into the office, they have a very hard time connecting into the network. And so we've been trying to work through that part of it. But people are hesitant to go back. Some of it is because of some of the guidance and requirements for our employees to go back with face coverings and all of those kinds of things. They don't feel real comfortable with that. And so we're just telling folks if that's still the case, then they are fine to continue to work from home. But as time goes on, we're going to, continue to just try to encourage folks to do it, even if it's 1 or 2 days a week, to have them test the water and see that it's not the end of the world to wear the face coverings going to their, the common areas and other places along those lines. So we'll see. It's been interesting. I've sat in or have seen some emails from the HR forum through ACEC, and there are many companies that are doing it in a much slower fashion than probably we are. So it'll be interesting to see how that plays out as time goes on as well. But I would not want to be a commercial real estate person right now. Just saying.
Yeah. I hear that.
It looks like Rachel has her hand up. I don't know.
Hi, this is Rachel Burkhardt from WSP, and so I thought maybe I'd just report on two things, the office situation and the field situation, since we had a little bit of update on both. So relative to the office one, we're in a very unique situation where we won't be rushing back because our main Boston office was in the middle of a move during the pandemic. So our previous location is gone and our new place isn't ready for us. So we're probably going to be one of the last ones to get back to the office just because we don't have an office to go to. On the other hand, our VPN and our offline stuff has worked pretty well. Sometimes we're using that. Some projects are out on Project Wise, and some of those have worked out okay some days, and then some days it doesn't work. And when they moved our servers to another WSP office, little did they know that a week later, twice we would have power outages. So that hasn't helped us. But by and large, folks are doing that. And we've done similar things to what other folks with surveys. And a lot of people, again, seem willing to, stay out for extended periods of time. For the same reasons, people find their schedules more flexible. And we find that each other is more available. We can get a hold of each other when we need to. Use any of the various tools to, collaborate in small groups and then have some regular group meetings, by department. So that's going in that fashion. And then similar, I think, to other folks there, we do have a whole, training we have to do about going back, which I've taken. And the process is fairly arduous in terms of, showing up, washing your hands, cleaning your desk, taking off gloves and throwing away and washing your hands again. Under worse circumstances, it seems like when you go through everything you have to do, it take you 15 minutes, a half an hour before you can even start work. And then you have, other things that are probably even more cumbersome to do in the office than at home. So it's not exactly a situation that I think, for the mass majority of people who've gotten used to working at home, feel like they really want to rush back to the office. So that's kind of our office situation. In the field, I think the last time we met, our construction project hadn't restarted. So now it has restarted. We started with a safety stand down day and kind of went through all the procedures that our contractor had set up, that both their folks and me and my field staff before, we were all complying with those. So we have now, that health and safety plan from the contractor. We have other requirements from our office. So every morning, we all have to get up. We have to do a corporate self-certification online that allows us to go to the office. And then, we also need to do the mass COVID-19 self-certification as well and submit that. And for our group here, I'm the COVID-19 officer, so I get everybody's forms, and then we verify that they're all good to go to work, and then we start our day. But even when I come in the office, what I do is I still come into this field office, I clean off my desk with the disinfectant and all of that, and then get to work. And then we have a cleaning by our contractor who maintains the office. They hired someone to come in and do a cleaning at the end of every day. So we have the clean in the morning, clean at night protocol is being covered by that. So that's kind of that. The contractor seems to be doing fine. They had been working in other sites, so their process worked, and they did come up with what I think a lot of people think is kind of one of the coolest looking hand wash stations in outside and all. So if anyone wants a picture, I can send a picture of a nice one of those. But they do have those available, so that you can wash your hands with water and soap outdoors there. So anyway, that's kind of the summary of our things.
Thank you, Rachel.
This is Terry from Collins Engineers. I just wanted to mention, kind of on back of what Rachel mentioned about the training requirements. We've been following the CDC flow chart, and as part of that says, conducted training for all your employees. And I'm not sure what all the other companies are doing as far as what their training looks like, but we've pretty much broken our training into two parts: office orientation to return into the office, and then disinfection training, because as Rachel mentioned, we're having daily contract cleaners coming in at night and cleaning, but personal workspaces, when people come in the morning, they're wiping down their laptop or their phones and stuff, they're responsible for that. But they're dealing with chemicals, and they should be trained on the use of those chemicals. So we conducted we did a virtual online training for that. It was a short training, but very informative. I got a lot of good feedback on it. Some people were surprised. We talked about the EPA website, where you can put in the EPA number that's on the disinfection chemical, whether it's Lysol or Clorox or whatever, and it gives you data, including how much dwell time it takes, whether it kills the coronavirus and how much dwell time it takes. Some people were surprised to realize that, when they wipe down something with a Clorox wipe or whatever product they're using, they're all different times. So for Clorox wipe, for example, it's 4 minutes. So that surface has to be wet for 4 minutes. It can't evaporate. If it's evaporating because you're in the middle of you got a lot of windows in your office and that wipe, the surface comes dry within, say, a minute or two, you got to wipe it and keep it saturated for 4 minutes in order to kill the coronavirus. So I think a lot of people were surprised, and that was good information. Just as far as a status, we have all our offices now this week. Various of them are at 25%, like Massachusetts. Some are, in some states, are at 50%, and some are 100% of allowable capacity, but not even the ones that are allowable to 100%. Not everyone's in, as everyone has mentioned, that people have decided to continue work from home, and that's fine. That's continuing to work. And the ones that are at a limited capacity, like 25%, we didn't have because we had surveyed everyone, we didn't have an issue where we had to say, okay, 50% of people want to come in this week and we can only allow 25. We were able to negotiate that 25 pretty easily based on knowing which people needed to come in and wanted to come in. We've been following all the CDC and state regulations, including our policy is when you enter the office, you have to wear face coverings and walking around the office, obviously wearing facial covering as well, and at least 6 feet apart. And we've created a number of signs. So we did, second part of that training was an office orientation where we showed everyone what the signs were and what they meant. And I think we came up with about 15 different signs that we had. Some of them were informative, some were more directive on things like occupancy of one, maybe in a small copy room, where before you could maybe fit 2 or 3 people in there doing different things. Now you'd be hard pressed to fit one person and make sure that there's good 6 feet around them. So we've turned that into occupancy of one type of a room for some of our rooms like that. So that's what we've been doing, and I'd be interested in hearing what other companies are doing with regards to type of training that they're requiring before people come back into the office.
Thanks, Terry. Yeah, I know training is a big piece of this conversation. Many, if not all, of the various state reopening guidelines that I've seen have some level of training requirement. Some are better than others and give you a 2-page list of all the different topics that you have to train all employees before they return to an office. Others just have a 1 bullet point saying you have to have a plan and you have to train the employees on that plan. So it kind of varies state to state, but a training is a big piece of this. And for, a lot of us, that can just trying to deliver that type of training in this current environment could be a challenge. Fortunately, GEI and Terry, it sounds like you and I'm sure others have figured out how to do either an in-person training like we're doing right now through Zoom, and you can invite people and make sure they come through it, or you can develop, virtual training through a learning management system that you can assign out to people and they can go, get through it on their own. But the training piece is certainly a part of the conversation, and how you address that and make sure all the employees understand, not only your own specific company requirements, but what the state is requiring and all of the things that we have to do now, right? It's very different. And what we're saying at GEI is, even though we're navigating through this stuff, none of it's going to be fun. And I think Rachel did a good job explaining, what you have to do just to come in and sit down at your desk before you can get started to work. And that's going to be something we have to do if we're not just waking up and walking into our home office. We have to go through all those steps to, put on PPE and disinfect properly and make sure we're doing everything we need to do. So we have to get that message across to all employees and make sure that they understand that as well. It's going to be a heavy lift for a lot of the people on this call and for a lot of companies, but something else that we're all working through. Does anybody else have questions, concerns, comments, stories? Just want to give us an update on what you're seeing and some of the challenges you may be coming across.
This is Maureen Wickland with VHB. Hi, everyone. We made the decision last week before phase 2 was initially announced to start today that we would push for people to continue to work from home through Labor Day. Because we have a lot of young families, parents with young kids, and they really were struggling with what they were going to do for the summer and camps and schools. And we found that the staff have really appreciated that. So we're sticking with a minimum or maximum of 5% occupancy at any one time until, until we decide to, increase that. But we really are recommending everyone continue to work from home until Labor Day. We had done a lot of investment on the IT side prior to this hitting, fortunately. So we've really adapted well to the remote environment. It's almost been seamless in many ways, knock on wood. But right now we are, obviously, even with up to 5% staff in the offices at any one time, we're struggling with making sure that we're complying with all the various state requirements. Our New England states being the most conservative. New Hampshire is requiring temperature checks. Vermont has different training requirements. So that's kind of what we're trying to get up to speed with right now, is to get those things in place so that when we do come back in a bigger capacity, we'll be ready. We also did an employee survey, and most staff are very supportive of working from home on an ongoing basis. And definitely some of the things I heard Steve and David say about masks and other things that is just going to be challenging for folks. People echoed that. So it seems like our folks are really happy and being successful working from home. So we're going to just continue that as much as we can through the summer.
Yeah, you hit on a key point there. That's definitely been a concern with all of our employees, is the ones especially that have young children, what to do with their children for the summer. And so again, our employees are in the same boat, where they really appreciate that no one's pushing them to come back in the door, because there's just there's no childcare options out there currently. They're still trying to work through that in most of the states as it is right now. One other thing I've heard a lot of people talk about is the challenge of working remotely as far as your network. We've been fortunate our network was upgraded as well before this hit, and we did have some concerns originally as far as what that would look like, but we've sustained fairly well. The only issue that we've seen so far is with a couple of the AutoCAD programs, I guess. It seems like MicroStation seems to work well remotely, accessing our in-office network using VPN, but AutoCAD has been a challenge. Besides ProjectWise 365, there's also Bluebeam. I'm not sure how many people are using Bluebeam right now, but Bluebeam's been pretty fantastic. I've used that before now. Our company's kind of hesitant to put a lot of files on there, but working with New Hampshire DOT, all the projects we worked on in the I-93 corridor were all stored on there. Very easy to access, no issues with crashing. If you had the program on your desktop, you could access, you could upload files to Bluebeam as if it was just your cloud network. So a lot of people don't normally think of Bluebeam that way. They think of it as collaboration tool for PDFs, which it definitely is, but you can also establish a network on it where you can save any type of any file on there, and it actually works on a check-in, check-out system So you can access a particular file. And when you do that, you check it out so someone else can't get into it while you're in it. And it'll tell you that, Steve's on it right now. So, you can get notified when Steve's out and Steve has to check it back in, and then I can access it. So if anyone's having any issues with that, I know this isn't the IT forum, but just wanted to throw that out there that it's a relatively, I believe it's inexpensive. And as far as capacity, you can store volumes and volumes of data on there. We haven't encountered a limit yet on what we have put on there. We've put on a whole bunch of stuff. We use drones. We have a lot of drone footage up there, and haven't had an issue with that. And that's our largest consumer of data. So if anyone's looking for an option, consider Bluebeam.
So this is Dawn. Hi. I have a question about whether we're starting to see, or folks are starting to see, clients have more of an in-office presence. I know I do proposals a lot, and we're actually starting to reprint or print proposals, whereas before it was electronic submittal only. So I'm wondering if you're starting to see more of that as well.
From the faces I can see, I've seen yeses and nos.
I was gonna say, thought I was the only lucky one, I guess.
I know we've done both in our office. We've had some clients that have been print proposals throughout, but the majority of our clients have gone digital.
Obviously preferable.
I will say that we had an in-person presentation last week with one of our clients, and we went through a process to make sure to train our staff. There were multiple people, so the recommendation was to continue to adhere to face coverings and all of those kinds of things, except for the person who was speaking, of course. We indicated that was okay, but we had a lot of cleaning requirements for folks. So as the next person sort of came in to take over the presentation, it was making sure to wipe down whatever had been touched by the previous person. So if that was the laptop, or there was something else that, the pointer or whatever else in regards to that, those were little things that we wanted to make sure people thought of when they went into the presentation. So again, it's those odd things that you would never think of until now. And now it's really having to put that focus on there.
What about field challenges? Anyone had any challenges with their field personnel adhering to the rules, or in particular the contractors you're working with, or the contractors that they're working with adhering to the rules? Anybody want to share any stories or anything about that?
Yeah, I'm not so concerned about our employees. Our field folks are following through as far as we know, and certainly we continue to communicate out. But I will say I've heard multiple stories of contractors not doing the same. And so we're just trying to encourage our employees to speak up appropriately to, somebody's coming in too close, to indicate that the 6 feet social distancing should be happening and all of those kinds of things. But the contractors is what I've heard more than anyone.
I'll mention for the project I have in Somerville, we're finding that the general contractor is doing pretty good about that. And we actually, our client, said that we're doing much better than some of the utility companies. We did have a subcontractor in last week, and they were doing paving. And so it was a really hot day, and none of them were wearing masks. And anyway, it was in the public area, so that came back as a comment in that regard. And one of the things that, as we drill through the use of masks and all, the state guidelines seem to be only if you can't meet the social distancing, the need for masks. So that's something that perhaps the public isn't clear about, and another project that was in Somerville here with the state, they had explicitly said that if you can maintain social distancing, you don't have to wear your mask while doing certain forms. And particularly as we're getting into these hotter days and the hotter weather, the workers are in a situation where they need to, both drink some water from time to time, but also they need to breathe a little more and get a little more oxygen in their lungs, just doing their standard work activities just for their own good. So I think that's something that maybe needs a greater clarification about the use and when you don't have to necessarily use a mask in the field if you can socially distance, because I think that would help, people, and also to get that out to the public so that people aren't criticizing folks if they are meeting the guidelines, but someone's not wearing a mask at a particular point in time. So.
I think that's a great point with regards to wearing the mask and the social distancing, needing a clarification. I think also what I've been finding and trying to let people know about is the CDC right now says, they recommend quarantine. If someone does become symptomatic and is sick, if you were within 6 feet of them for a prolonged distance, even or a prolonged period, that's most places is over 10 minutes. But even if you're wearing a mask, they don't give that because they're not considering that full PPE, a face covering, fabric face covering. So you're still having to quarantine. Whereas if you had that 6 foot of distance, then you're outside of that and you do not have to quarantine. So if someone does become sick, even if they don't have COVID-19, they got the flu, you're still stuck at home. Can't be out on the work site until that person is tested and everything else. So that 6 foot is a tremendous thing that everyone has to remember to do. Just because they're wearing a mask, they're not invisible, or they're not invisible to the virus. And another point of clarification that we've been working on with all our staff is to remind them that my mask protects you and your mask protects me. So a lot of times people feel that just because they're wearing a fabric face covering, that is protecting them. It's really not protecting them, it's protecting others. And I think that's just a point that we should all try to clarify with our staff so they understand the value of the mask, but also the value, tremendous value of staying at least 6 feet apart.
Absolutely.
We did have a question. Pennywiser put a question out in the chat, and it's a good one because it does kind of go into some of these gray areas here. So I'll just read her question. For employees who have had exposure, close contact with someone who is tested positive, are you requiring a 14-day home isolation, or if they're critical infrastructure workers, are you allowing them to continue to work under the CDC guidance as long as they remain asymptomatic? The CDC guidance allows them to work if monitoring their temperature, wearing a mask, regular disinfection, and social distancing. Anybody want to comment on how they're handling something like that, where an employee knows they've come in contact with somebody who's tested positive, yet they do not have symptoms? What are your requirements there?
This is Terry. I'll just mention that what our policy is, we have not had anyone test positive for COVID-19, but our policy, we were following the critical infrastructure guidelines, but now as things are opening up and we're starting to return back into the office, we've transitioned into the non-essential guidelines, so that if someone does come in contact with someone who has COVID-19, we're requiring the 14 days. We're not going to consider them critical infrastructure, essential worker, and let them keep on working until they themselves come down with any of the symptoms. Which I think that was a great question, because it is still allowed if, you know, and under the transportation, I think all of our firms are deemed essential workers. But we've said that now that essential workers are mixing kind of with non-essential workers. Again, you might have a bridge inspector in the field that's an essential worker, and maybe someone back in the office who's not really could be deemed an essential worker. So again, we're trying not to mix anyone. We have not had to actually implement that policy, but that's where our policy stands right now. Again, we've had no cases of COVID-19, but if someone does notify us that they've tested positive, anyone that's been in contact with them would be quarantined for 14 days. That's our policy.
I just want to add a little, I've actually had a couple of cases. We had one employee who is living with somebody who tested positive. When we were notified of this, we told her she had to, and this is the difference between isolation and quarantining. We told her she needed to isolate for 14 days. If she showed any symptoms, she needed to seek medical attention. And if she did show those symptoms and seek medical attention, if the tests came back negative, and we require 2 negative tests to come back in a case where you are directly associated with somebody in your home. And she tested negative both times. Luckily, she is an essential worker, but she is able to work from home. And anytime she is in the field, she is just doing isolated work anyway. There's absolutely nobody out there doing what she's doing. She's doing substation line transmission inspections. So she's out in the woods by herself. And I have another case where one of my employees was sent home with a fever, middle of the day, in the middle of field work. You've got National Grid, you've got other utility companies, you've got contractors, and he's in the middle of it. And we had to notify everyone that he was sent home. He was tested. Thank goodness he's tested negative, but we're waiting for the second test. But we are requiring him to still stay home for the 14 days.
Thanks, Meredith. I think, you know, the way you're approaching it is kind of how we have to do it. And every case is going to be a little bit different. And you know, GEI, we've developed a, you know, SOP of sorts to just ask the right questions, because there's a couple different pieces of all of this. It's, you know, the health of the employee and making sure they get the medical care they need, whether they're asymptomatic or they do have symptoms, to at least speak to a medical provider and get guidance from that aspect. You know, that's difficult for us to give them medical advice if they know they've been exposed. And then to your point, Meredith, to get those, you know, those negative tests that are recommended by the CDC, and many of us have put in place, and part of our protocols is to have those negative tests to confirm that somebody is okay to come back to work. So in order to do that, you have to seek some medical care, symptoms or no symptoms. The other piece to all this is that contact tracing that Terry was talking about, is trying to figure out, okay, you know, whether or not you have symptoms, you may have been exposed to that, you may be carrying the virus. Who do we have to notify that they may have come in contact with to prevent the spread? So to that point, you know, we've developed a reporting tool. It's a simple form, very similar to what we do on a normal safety incident reporting form, but it's COVID specific. And that is, you know, kind of a first report of exposure type thing. And we go through a series of questions to try to figure out, you know, the contact tracing piece. And we've also developed, I think Rick Eckerd talked about what GZA did on our last call, is they have a daily check-in, check-out type of app. GEI has something similar, so we can know where people are working. And if that specific person does report an exposure, we have records of where they've been, who else has been in those areas, whether they be offices or project sites, and we can start to hone in on this contact tracing piece. So, you know, unfortunately, to all of these questions, there are no real simple, clear-cut answers. But I think if we ask the right questions and we try to figure out, one, let's get the employee the medical care they need. Let's get them kind of segregated away from the potential of exposing others until we have more information. And if they potentially did expose others, who are those others, so we can get them the right care and give them the right direction. So, you know, that's the general way to kind of go about it and how it all gets implemented. There's no one way to do it, I don't think. Penny, hopefully that one way or another addressed your question. If not, let us know.
Are there other questions or topics that people would like to raise at this time?
So I would like to ask about the work from home. So after several months now of working from home in kind of less than optimal office setups, are folks from your offices asking that you provide, equipment and that kind of thing to support their work from home ergonomically?
Great question, Don. We haven't gotten any ergonomics questions, at least at Hoyle Tanner, but we did when we first closed our office that week of March 17th. We basically told everybody to bring everything they needed home. That message seemed to resonate clearly for the majority of employees, but there were a few that apparently misinterpreted it. So once we started opening the office out, we reiterated the fact that those who want to stay home are welcome to come in and get the things they need and bring them back. So we've gotten no comments on that yet or questions. And actually our safety committee is meeting tomorrow, and I'll actually bring that up to reach out to everybody and have them let us know how's working from home for you, how's that working out. Not necessarily a can of worms anybody really wants to open, but if there's tips and tricks that we can give people that, hey, remember it's a work environment just in your own house versus in the office. There are things that you should be doing to make sure that you're seated in the right way and using your space the right way to not encounter other injuries. And again, that goes back to the whole working from home and home worker safety that we're going to need to breach in the coming future, or coming as a coming topic. But yeah, as far as us, so if anybody had any specific items that they had to help them ergonomically at work, they're welcome to take those home if they could get them there. Obviously, some of the Versa desks, what have you, would be an issue, but keyboards and ergonomic keyboards and ergonomic mice and things like that, people are welcome to bring with them.
Yeah, David, on that, we did very similar thing, told everybody to bring what they need home when we started moving everybody out of the offices. A couple other things we did was very early on in some of our communications, and then in some all company employee calls and things, we've talked a lot about ergonomics and not only the specific setup of workspaces, but just making sure that people are taking enough breaks. I've found it's very easy for us to be sitting here working at home, and we can sit at this desk for hours on end, especially as a safety professional these days. There's plenty of work to go around, and I can sit here for 10 hours and it'll fly by. But that goes for everybody who seems to be a little more efficient working at home right now, can focus a lot, but they're not taking the breaks they need. So we've really focused on having people, get up, walk around, go outside, take those breaks, not only for your mental health, but for your physical health and for the ergonomics. And then we have had a few employees reach out to our safety group and voice some concerns, whether they're feeling fatigue, in parts of their body or starting to experience some pain, whether it's, because of their setup, because they're working from their dining room table and not necessarily something that's designed for people to work an 8-hour day or more on. And we've gone through and thankfully our ergonomic evaluation process can travel. It's not specific just to an office. So we've done some evaluations virtually. We've had some conversations with employees. A couple of them resulted in, purchasing some ergonomic equipment that helps them be able to work a little more comfortably. Other times it's just a few adjustments and that have worked out. But it has been an issue for some employees, and keeping it on the top of their minds and communicating it, I think has helped. Everybody understands that, yeah, I'm not sitting at my work desk. I may be at my kitchen table or dining room table or some kind of ad hoc setup that they put at home. And it's, we have to go through and do the same type of evaluation to make sure that we're going to be comfortable there.
And this is Rachel Burkhardt again. So I was just going to mention that, for WSP, first of all, we did allow everyone to bring home computer equipment in terms of, auxiliary screens and mice and keyboards and things like that, docking stations. And then we also had the advantage when the office did close that, basically any of the furniture was going to get thrown out. So if you had a nice, comfortable work chair, as opposed to sitting on a hardback dining room table chair, you could bring that home. So we did have that opportunity for folks to kind of enhance their home environment as well. So I think that's an important thing to bring up, and then at least for myself, after a couple of hours, I just get tired, whether I'm here in the field office or I'm at home. And I just go and get a walk or something like that, and just to kind of stretch a little bit, because that's probably the most tiring thing of the current work style. I used to have a lot of meetings or other people coming by, and I'd be standing up, sitting down, moving, going to a conference room or whatnot. And now when you just sit there for hours on, meetings or something like that, it's more tiring actually than what we were doing before, I think so.
I completely agree, Rachel. Going to the chat room, Penny asked, I think it would be if Steve would be willing to share your contact tracing form.
Yeah, I can share what it looks like. Like I said, it's very simple. It's a daily check-in, check-out that we've developed for all of our employees. And it's built within our SharePoint or our Office 365 platform, where it will just collect that data. And then if we need to go back and look, we can run reports and things. But I can send out at least a screenshot of the questions we ask for everybody. I'll make that available to the group.
Thank you, Steve. Are there other questions and issues, or David always has a great list of things he's been thinking about?
Well, it came up in the conversation earlier. Anybody having any issues with the demonstrations or protests or anything like that? Is that impacting anyone's job site or access to their work location as we're trying to bring work back together? I mean, it's mostly in the larger cities, so for us it would be Boston, but I know that there have been rallies in the smaller areas. My office here is in North Andover, and there was a demonstration in North Andover sometime last week, as well as Lawrence. So fortunately, I wasn't impacted directly, but has anybody been impacted? And what are you doing? Has field work been an issue, or has office access been an issue?
I'd like to jump on that. I've got several sites in Providence that people are working on, let alone living near. A few of my employees have actually left their homes to go to other areas just to stay out of the danger that could happen. We're just preparing for the worst and hoping for the best, that the word gets out that needs to get out, but just to make sure that they're safe in all situations. So far, nothing big during the day. No overnight work that we've had has encountered any of it. But it's just more of a safety issue. And they did a giant briefing with all of our employees last week in regards to just be safe. And if you get into that type of situation, just leave.
Yeah, I can jump in a little bit. Fortunately, I haven't been made aware of too many impacts at GEI. We did have one instance late last week in a project in Washington, D.C., where there was some neighboring activity, neighboring a project site, and gunshots were heard. They quickly shut down the project site, sent everybody home, and we're reevaluating the situation today. I have not heard what those reevaluations resulted in, but they were monitoring what's going on in that area before they reopened the project and resumed work. So that's the only instance that I'm aware of that's impacted us, but it's one of those things that we're trying to monitor, although it does change from location to location and kind of pops up out of the blue. Fortunately, like Meredith said, a lot of it isn't taking place, or at least the violent protests are not taking place during the day. A lot of those seem to be in the evening and nighttime hours, but there still are a lot of the peaceful protests going on throughout the day, which just can cause disruptions locally anyway. I know even here where I live in Somers, Connecticut, northern Connecticut, right on the Mass border, there's a protest planned today. I live in a small town, and I think it's a protest of 400 to 500 people that are going to be marching through the town. So even things like that can cause disruptions, whether it's like Dave said, a smaller town or in the bigger cities.
Do want to add one disruption that we are finding during these protests is lack of internet. I'm not sure who or why or what. That's not my job to figure out. But I have employees that are in hot zones that they just can't, their internet is so disrupted that they just can't work. This is the day protests, the night protests especially. That's becoming an issue. I have 3 of my employees that I have to send hotspots out to because we thought there was just something wrong with their home internets, and it wasn't. It was just the general area is having, whether it be issues or lockdowns, we don't know.
Excellent point. Yeah, it could either be a lockdown or it could just be the sheer volume of people that are on social media at the time when they're protesting, trying to stream their content while they're out there. Either or, could be something more sinister. People, blocking out the area so that content isn't getting out. Who knows? But yeah, I remember that from the marathon bombing. There was basically, once things happened, that whole area went dark, either because it was a high volume of call traffic trying to go out, or because they had shut down specific areas because of trying to track down what was going on. So that's definitely another issue to have to deal with the protesting.
Any other issues that people would like to bring up at this time?
I have one more that I was going to bring to the group, and I don't have a lot of data or information, and I know it's a very state-by-state issue, but it's something that I think is going to start popping up, something that is certainly on my radar, and it's for not only the safety committee or safety forum members, but also any of our peers from the HR or even the risk management group that's here. It's workers' compensation. We've talked about it. We've had various presentations over the past couple of years on it, but this whole COVID-19 is starting to become a separate issue with workers' compensation. And I know there's a variety of states that have compensability presumptions being evaluated right now in the governments. Massachusetts is one of them that has a presumption of relatedness for essential workers in joint committee right now. So we'll see what that means. I know California did do something early on for a compensatability presumption for all workers, not just healthcare or emergency response workers. But they put a deadline on that to July 5th. Now, I don't know if that's going to get extended, but basically it makes things operate, the way I understand it anyway, makes things operate the opposite of how workers' comp normally works. Workers' comp, usually if an employee gets injured or if an employee gets sick at work, the employer has to deem whether or not it's work-related. The way these things are working now are being proposed to work for COVID-19, if the states pass them, is that the presumption, if the employee went to work and then got sick within 14 days of going to work, the presumption is they did get it at work, unless the employer can prove otherwise. So it kind of flip-flops things. Like I said, every state's a little bit different, and it's just something I'm watching. So I don't have a whole lot of data. I know the NCCI does have a summary spreadsheet with a variety of different states and what their status is on this. But it's something I'm watching, and I just kind of wanted to put it out on everybody else's radar to see if that's going to impact you or your operations. One more thing to think about.
Thank you for bringing that up, Steve. It is something that ACEC National is monitoring on the national level, looking at how Congress is going to handle this issue, and we are following that on the state level in Massachusetts. Well, I don't see anything else in the chat room. I didn't know if anybody else wanted to open their microphone with any other issue they might want to bring up. Okay, Dave, you have any other issues on your list?
I was just checking through. I can't see anything in particular. I think we've covered all the major topics now. Again, 25% with no yardstick as to when that's going to go up. Definitely a concern for everyone. The protests and those issues. Dealing with people who've tested positive or who are in contact with people who've tested positive, and policies for bringing people back to the office versus working from home for extended periods of time. Yeah, I've got nothing else on my list.
That's fine. We learn as we go. It's an evolving process. I want to note that we did record today's session, and we will be posting it on YouTube and making the link available. You should see it in ACEC Matters on Thursday morning at about 8:30. If you do not receive ACEC Matters on Thursday mornings at about 8:30, please email me at agoodman@engineers.org, and I'll check to make sure that you're on the list, but you also have to check your spam filter. I want to thank Dave Langley and Steve Hawkins again for their leadership of the forum, and our special guests who have been wonderful providers of input and sharing, Rachel Burkhart and Terry Brown, and Meredith, I want to thank you as well, and Penny Weiser for your questions. We are scheduled, we at least have on our web calendar to do this next forum on June 29th. I didn't check that date with David or Steve. You want to give me a nod whether that works for you? I know people are entitled to vacation at some point this summer, so I didn't want to interfere. But tentatively, that's what, Steve gave me a thumbs up and Dave gave me a thumbs up. Great. So, so we'll look at the 29th for our next forum. I'll just confirm some times to make sure we're not hitting some other ACC mass meetings. And now, as Rachel said, it's important to get up and stretch and maybe even take a walk and enjoy some fresh air. I've got to remember to do that as well. So I thank you all for participating in the forum, and I wish you all a great afternoon. Thank you.
All right, thank you.
Thanks, everyone.
Thank you.
Thank you.
Like Connie and Don as well.
Oh, Connie and Donna as well. Yes, sorry about that. Yes.
Bye.
Bye. Oops, I ended on the wrong computer. I'm on two computers.